Hello, today I'll be demonstrating how to do an IM intramuscular injection for my patient. First thing I'm going to do is I'm going to read my doctor's orders, and then I will compare them to the MAR, see if this makes sense for this patient. And yes, the medication makes sense for what he is, his illness, and what we're trying to help him with here. And so I'm going to go to the, that's my first check. I'm going to go do my second check in the med room, and the medication is asking, doctor's orders is asking for a intramuscular injection. So I'm grabbing my supplies. This is the pretend medication, and I am going to draw that medication. That's my second check. Making sure the medication is not expired and is good to be used. So non-expired medication is good. So I am going to draw the medication, and before I do that, I am going to, it's calling for half of ml, so 0.5 ml. So I drew air. I'm going to pretend this ampule is new. So if it wasn't new and it was for multiple use, I would clean the top very well for about 30 seconds. Now I'm going to draw my medication. First I'm putting in the air, and since this is a pretend and my ampule has water, but we don't want any water, I'm just gonna lower it down so that I don't draw any water and put it in the trainer. So I am going to do 0.5 ml, and I have 0.5 ml. I have no bubbles, so I have that. I'm going to use the scoop method to recap it. I'll bring my ampule, since it's got the medication on here, to the patient's room. So I have my injection medication, and I have a prep pad, alcohol pad as well. So going my patient, come in. Hello, I'm Eddie. I'll be your nurse, and can you tell me your name and date of birth? Patient states name, full name, and date of birth. That's two identifiers. The reason why I'm here is because I have your IM intramuscular injection that I have to give you, and that the doctor ordered. Do you have any questions? So I'm gonna check. Do you have a preferred site? See if there's anything that could be in the way, any injury, any soreness on your muscles or anything. Do you think deltoid, this area, is that good for you? Okay. All right, so I'm going to use the deltoid, and I'm going to use the Z-track method. And so I already washed my hands. I'm going to go ahead and glove up. And then I'm going to expose my patient. I am going to prep the site. Once again, start from the center of the site, scrub real well, and work my way out. All right. And I'm going to let the side fully dry. I'm not going to fan it. Side is already dry, and I'm going to warn the patient. They're going to feel a little poke, and I'm going to pull the skin taut to one side, and then I am going to go in at a 90 degree angle, inject my medication, and then I'll pull the needle out and release. I would put the safety on, but for practice reasons I won't do it. because we're students, we don't have many of those. And this will go straight into the sharps container. I'm going to put pressure and hold until the bleeding stops. If in case it doesn't stop, I can always put a little band-aid. How you feeling there? Feeling good? Okay, no complaints. Do you have any questions? No. All right, so I am going to put the patient back into a safe and comfortable position. I am going to give him the call light, and be sure to call us if you feel any pain or anything on the site. Please let us know. I'll come back and check on you in about 15 minutes. In about 20 minutes, I'm sorry. And then, okay, I'm going to remove my gloves, hand hygiene, remove the curtain that I put on for privacy, and I'm going to go document.